So, good morning, sir. I'm Adrian Vincent MU. I'm gonna be your student nurse for today. So, this assessment, sir, is necessary so I can find out if your breast and axilla are having symptoms of cancer. So, sir, can I know your identity such as name and age? Okay, sir. Now I will perform hand hygiene. And don't forget to provide the privacy of patient. Sir, first I will inspect for your breast for size and symmetry, sir. And the skin contour. Akyat ko po t-shirt niya, sir. Okay lang po. Sige, sir. So, sir, based on my inspection, sir, findings are just normal when the both chests are in symmetry, good contour, and normal size po, sir. So, sir, dito po kayo tingin sa akin. Now, I'll inspect po, sir, the skin of your chest to know if there are discoloration, hyperpigmentation, dimpling, hypervascular areas, swelling, and edema. Inspect ko po, sir, skin, the area of your chest. So, sir, finding are just normal, sir. Sir, I will check now for your retraction of your chest. Sir, raise arm nyo po above head. Then, after raise your arm above the head, push hands together while flexing the elbow po. Then, next, press nyo po hands nyo down into the hips. So, sir, based on my observation, your muscle contraction within your chest and your chest, both left and right chest are in good contraction po in every movement that you did. Sir, ngayon po, sir, taas nyo po damit nyo ulit. Okay lang po ba? Sige, sir. I will just check, sir, the area of your areola. If there are problems regarding shape, color, and symmetry, or may lesions po siya. So, sir, normal findings po, symmetry of areola within right chest and left chest, no lesions, and no skin problems in the areola. So, sir, tingin po ka sa akin, sir. Next, sir, I will palpate your axillary. Palpate ko po yung axillary niya, sir. Dito po, parte. Then, sir, yung subclavicular lymph nodes niya po. Also, the supraclavicular lymph nodes. So, sir, normal findings po, no tenderness within lymph nodes, the supraclavicular and the axillary, also the subclavicular lymph nodes. There are no lesions po or tenderness when I palpate you, sir. Next, sir, akyat nyo po arms nyo within shoulder length po. Ito po muna mauna, sir, left nyo. Then, patong nyo po sa arms ko, ganito. Then, I will start to palpate, sir, your edge of the greater pectoral muscle. Then, the thoracic wall in the mid-axillary area, upper part of the humerus, and the anterior edge of the thymus dorsi, sir, muscle. So, sir, these four areas that I palpated in your axilla are in good condition, sir. No tenderness, no edema, no lesions, no nodules, sir. Next, sir, I will palpate your chest to know if it's masses or if there are tenderness and discharge in nipple. I will palpate it, sir, circular motion, and I will ensure that all the areas of the chest are being palpated. First, the right chest and the left chest. Then, based on my palpation, there are no tenderness, normal texture, no signs of edema or swelling. Now, I will try to palpate the areola and the nipples. I will compress each nipple, sir, to know if there are discharge, sir. So, wala pong lumalabas na fluid nyo po sa nipple when I palpated the left and the right nipple po. So, it means that there are no discharge, normal findings, no hard parts on the chest during palpation. Sir, next, I will document findings into the MAR. For the answer, later po, tuturuan ko po kayo ng chest assessment techniques po para magawa nyo po if ever po may problems kayo para malaman. Now, sir, urong po kayo konti, sir, dito. I will assist you po, sir, na supine position. Sir, ito kayo. Urong po kayo, sir. Okay, sir. Tingin po kayo sa akin, sir. Ganyan lang po. I will assist you po. Then, sir, I will inspect the contour, color, and the symmetry of your abdomen po. So, all four regions of the abdomen nyo po, sir, are symmetry within color, contour, and there are no signs of nodules. So, normal findings po. Now, sir, I will ask you, sir, to take a deep breath. Hinga po kayo ng malalim. And while humihinga po kayo ng malalim, i-hold nyo po mga either 1-2 seconds bago nyo po i-release ang air. So, sige po, sir. Gawin nyo po. And I will check po, sir. So, based on my inspection, when nag-breathe po kayo ng hard breathing, normal po yung pag-angat and pagbaba po ng inyong abdomen. Hindi po masyadong excessive ang pag-angat, di din po excessive yung pagbaba po ng inyong abdomen tuwing paghinga nyo po. Sir, ngayon po, sir, hinga po kayo ng normal lang po, sir. Like normal breathing lang po, usual breathing nyo po. So, movement of abdomen while in normal respiration are just normal findings. There are no vascular pattern that are deviated from normal. Next, sir, I will use my stethoscope and I will auscultate, sir, your 4 regions of the abdomen. I will start first with the lower left region of the abdomen. I will auscultate it, sir. Then after the right lower region, I will now go into the lower left region of the abdomen. Then in the upper right region of the abdomen and the upper left region of the abdomen. So, sir, based on the auscultation that I did, normal findings po, sir. There are no vascular sounds or pesistorial sounds that are signs for inflammation. So, normal findings lang po. Sir, next I will palpate po, sir, the 4 quadrants of the abdomen, sir. Mag-start po ako dito sa, I will start here, sir, in the lower right region. I will percuss it, sir, several areas. Then, lower left region of the abdomen, percuss several areas. Sir, straight lang po. Kanya po akit pa niyo. Then, the left upper right region of the abdomen, I will percuss it. Then, the upper left region of the abdomen, I will percuss it. So, sir, normal findings po ng presence of dullness or tympani. Sir, I will now percuss your liver po. Sir, okay lang po, percuss yung liver. Area ng liver po. So, sir, findings are just normal, sir. Your size of liver is normal. There are no signs of liver inflammation or enlargement of the liver. Now, sir, I will do a light palpation to to your selected areas of the abdomen to find if there are tenderness in your abdomen. First, I will make sure that the 4 quadrants of the abdomen, I will palpate it. So, sir, based on my palpation in the 4 quadrants of the abdomen, normal findings po siya. Wala pong signs of tenderness or swelling po. Now, sir, higa lang, sir. I will now, sir, do a deep palpation, sir. So, normal findings po, sir. No enlargement and tenderness when I palpated the 4 quadrants of your abdomen and your liver, sir. Next, sir, I will palpate the bladder, sir. The bladder is located in the area above the pubic symphysis, sir, or the puson po. Sir, palpate ko po. So, sir, normal findings in the no tenderness. Now, sir, I will record findings in the MAR. So, sir, now we are check for eyes, sir. Can you sit down, sir? Upo ka, sir. Sinta. I will assist you, sir, na sitting position. Okay, sir, now. Tingin ka po sa akin, sir. Dito ka po, tingin. I will inspect your eyebrows for distribution of hair and alignment. Also the skin quality and movement. So normal findings, sir. Now I will inspect your eyelashes, sir, to know its evenness and direction of curl. Tingin ko po sa akin, sir. Normal evenness and alignment of the eyelashes po. Now I will inspect your eyelids po to know the characteristic, the position in and its relation to cornea po. And I will inspect your ability of frequency of blinking, sir. Sir, close your eyes po. Close your eyes. Huwag niyo po muna buksan so I can check the lower eyelids. Sir, normal findings po. Now, sir, I will inspect, sir, your bulbar conjunctiva and the palpebral conjunctiva po, sir. Tingin po kayo ulit. Check ko po. Open eyes po, sir. Sir, open eyes. Check ko po yung bulbar conjunctiva and the palpebral conjunctiva. So, normal findings po, sir. When it comes to color and there are no edema, lesions, and the textures are also normal. No symptoms of eye problem po. So, sir, in case na may problem po kayo, sir, i-demo ko lang po sa video kung paano po ang gagawin if ever the patient has problems in her bulbar and palpebral conjunctiva. So, in case may problem, if I find out natin within the conjunctiva, we should ask the patient to look down while keeping the eyelids open. Tingin po kayo sa baba, sir. Tingin sa baba and open your eyelids. Then, I will grasp the client eyelashes with my thumb and index finger. Then, pull the lashes down. Next thing, I will need place cotton tip applicator and above 1 centimeter the lid margin. and push it gently downward by holding the lashes. So, for further inspection for the color conjunctiva, note the lesions or foreign bodies through this assessment. So since wala, I will now inspect and palpate the lacriminal gland of my patient using my index fingertip. Yung lacriminal gland niyo po, sir. Palpate ko po Fingertip lang po gagamitin ko. So normal findings po, no edema between lower lid and your nose po. Now, sir, I will inspect the lacriminal sac and nasolacriminal duct. Sir, dito po kayo tingin, sir. So normal findings po, no excessive tearing in normal findings po of texture, no signs of swelling and edema. Now, sir, I will use my index finger to palpate inside the orbital rim, sir. Near the inner canthus, sir. Sige, sir, dito ko po palpate. Normal findings po, sir. No excessive tearing in the eye when we do this palpation po. Huwag ko pa maglayo, sir. Manarimaso akilang ka. Now, sir, I will inspect the cornea for clarity and texture. Sir, tingin pa po sa akin, sir. And I will use pen light, sir. First, I will locate the light into the oblique angle, then slowly in the areas of the corneal surface. So, sir, good findings po, sir. There are no good findings when regarding the clarity and texture of the cornea. Sir, don't be afraid because I will touch your cornea, but I will use clean gauze. This is important, sir, because I will check if your cornea is sensitive, sir. Sige, sir. Tingin ka po sa akin, sir. I will touch your cornea, sir. Okay, sir. Findings are cornea is sensitive and expected to be normal. Sir, I will now inspect, sir, your anterior chamber using the pen light. Sir, tingin ka po sa akin. I will check your pupil color, shape, and symmetry. But in this technique, we should use the same oblique lightning technique. First, we should locate in the peripheral area before we will put the light into the location of the pupil of the patient. So, sir, normal findings po. Now, sir, I will darken the room, sir. Let's pretend that the room is already dark and I will check for each pupil's consensual reaction to light. I will use again a pen light, locate the light first into the periphery of the eye, then slow move the light into the pupil. Left eye. Next, I will do it in the right eye. Tingin ka po, sir. Straight lang po sa akin tingin niyo. So, sir, good findings po. The pupil are in good findings. They're constrict symmetry when we talk about response to the light. Normal and symmetry construction to light. Next, sir, I will assess your pupil's reaction to accommodation. I will hold an object, sir, 10 centimeter from your nose. Sir, focus ka dito, sir. Mira ka, kiso ka, mira ka ki. Kasi arriba, mira ka. No makita lo sa mira ka. So, mira lang ka so I will alternate this gaze within far and near location. So, based on my inspection, it is normal findings. Pupil constrict when looking near the object and dilate when the object is far. I will also, sir, move the pen light towards your client's nose. Tingin ka po dito. Mira to, okay ulit ha. Mira ka, focus. Mira, di ko pupil. Kung symmetry, bale. Okay, sir. Your pupil is symmetry. It converge And it is an explanation of PERLA. Bale, sir, yung assessment po sa ay na ginawa ko kanina is an explanation of PERLA. PERLA is a pupil equal reactive to light. Sir, wag ka po maglayo sa akin, sir. Wala pa po tayo tapos, sir. Agihan ay kaso, naipakita ka ba? Now, sir, for your visual fields, please, sir, sit down. And I will do assessment of assessing your peripheral visual fields. Now, sir, I will let you sit into 62. Ali lang ka. I will sit you to sinta lang. 60 to 90 centimeters, sir. Sir? Close your eye po, sir, using your right eye, LSD, so ikaw one right eye man close kasi using card. Agwanta lang kasi. No, aki ka tapa siya na. Mira ka conmigo, mira ka. So, I will also close my eye using a card, but opposite in the one patient eye. Bale, if ginawa niya po sa left, ginawa niya po sa right, sa left ko po siya itatakip po yung mata ko. So now, I will ask you, sir, to look directly into my nose. Sir, look into my nose, sir. Bila ka na diminaris. In this assessment, sir, I will hold an object and move it into your visual fields in the periphery. Sir, if nakikita nyo na po yung object, sir, masilugod. Silang kansino. Silang kansina. Aganta lang. Agwanta lang ha. I will. And sir, if nakikita nyo na po yung object sa minumove ko, sir, just say yes, sir. So, first, sir, I will begin to test the temporal field within your temporal fields. Sina. No, masikwan kasi lang sina. Agwanta lang. I will now check your temporal fields between your left eye po, sir. So, sir, tingin ka po sa akin. I will extend and move my right arm into the patient right periphery. Sir, straight po laging tingin nyo. Sabihin nyo po kung nakikita nyo po yung ballpen. Nakikita nyo na po? Okay, sir. Next, sir. I will test the upward field of the left eye, sir. I will extend and move my right arm down from the upward periphery. Good, sir. Good vision. Nakikita nyo po, sir. Normal findings po within 50 degrees of upward field of the left eye po, sir. Next, sir, I will test the nasal field of the left eye, sir. I will extend and move my left arm from the periphery po, sir. So, sir, normal findings po, sir. They then repeat in the opposite eye. Dito po, sir. Opposite eye po, sir. Dito po, sir. Ito na po yung takpan nyo, sir. Ito po, ganyan. Hawakan nyo po. Yan, dito po sa atin. So, sir, sabihin nyo po if nakikita nyo na, sabihin nyo po, sir, if nakikita nyo na po yung object, sir. Okay, sir, nakikita nyo po. Same lang po ito siya kanina, sir. Now, sir, yung gagawin na po natin is the upward field na lang po, sir. Into the right eye na po ito siya. Same movement lang po yung gagawin ko po, slowly. Okay, sir. Mabuti, sir, nakikita nyo po. Same vision po tayo, normal po. So, I will test, sir, now, sir. Okay po, good. Normal finding, sir. Good vision in your visual fields between right and left eye. Now, sir, for extra ocular muscle test, I will assess 6 ocular movements to determine eye alignment and coordination. Bale, sir, yung gagawin na asitaki araso, mira lang ka na ballpen na kondeste mo be. So, mira ka kumigo ga. I will appropriate distance 30 centimeter in front of my patient eye. Sir, fixed position nyo po, sir. Follow nyo po itong pen light using eyes only. Huwag nyo po igalaw ang head nyo, eyes only. Sige, sir. Now, I will do the 6 ocular movements. Yung eye nyo lang po. Huwag nyo po yung head. Sige, sir. Mata lang. Abel os. Abel os. Mira ka na. Football ka na. Okay, sir. Normal findings po, sir. No presence of nystagmus and symmetry in movement. Di po. Yun, kwan po, sir. I mean by nystagmus is yung paglilibat po ng pupil. Next po, sir, for Hitchberg test, I will shine a pen light po, sir. Into your corneal surface, sir. So, sir, if when I assess the location of light, sir, into your corneal, the findings are normal. Light reflexes in the center of the pupil po, sir. Bale, hindi po siya sa side ng pupil nyo sa left or right po. Sa center po siya, and it is normal pupil contracting to light. Now, sir, for the cover test, close your... Upo muna, sir. Upo. For the cover test, close your one eye and face on the object at become near or far. Dito, sir. Dito. Wag dyan, sir. So, yung gagawin ko dito, sir, may object po ako. Nakikita nyo po. Tapak kadikaw unos, unos, abel uno. Mila kaki na object. Kung tagadalen near, cancer kalias na tagadaleleos mila ka. Okay, el otro lado también. El este cabri, este catranca, este cabri, este catranca. Sige. Este catranca. Mira ka, kung sir kali, mila din kung leos de. So, normal findings, sir. There are no presence of bad construction, bad contracting the eyes towards the object, good construction, sir. So, now, sir, for the visual acuity, try to read this newspaper po, sir. In a normal distance, try to read this newspaper po, sir, to test your visual acuity. So, sir, normal findings po. Nababasa niyo po ng maayos yung newspaper based on the usual distance of reading newspaper or books. Now, sir, I will ask you to stand for 6 meters or 20 feet. Ano may ito parang sila natin? Akin lang ito parte, standing lang to. Sinta. I have here, sir, my Snellen chart. Read the Snellen chart, sir. The first line in the 20 to 200. Then the second line of the 20 to 100. The third line, sir, the 20 to 70. Sir, tingin ka po, mira ka. 20 to 40. Sir, good findings, sir, within your vision. It is 20 to 20, sir. Next, I will document findings into the MAR. Sir, higa po kayo ulit sa supine position. And I will check for your muscles, sir, and joints, and also your bones. Ito po. Sir. Now, sir, I will inspect your muscle po, sir. And tendons for... Akus na lang. I will inspect your muscle and tendons, sir, for construction. So, sir, normal findings na po. Sir, next I will inspect, sir, your muscle for tremors. I will inspect tremors in your hands, arms, and the area in front of your body. I will check the pectoral muscle po, sir. If there are tremors. And your trapezius muscle, if there are tremors. Your quadriceps muscle. And your calves muscle po. So, normal findings lang po, sir. No tremors po. Now, sir, I will palpate your muscle while hindi po naka-flex. Sir, labas nyo lang po. Labas nyo lang po. Palpate your muscle po while hindi po naka-flex. Sa bicep po kung magsa-start. After sa bicep po, sir, pupunta po tayo sa tricep muscle. Sa deltoid muscle nyo po. Sa forearm muscle. Sa glutes po. And hamstring. And the quad sa i-repeat ko po to sa other side, sir. Pinapalpate ko lang po to siya, sir. Light palpation lang po ginagamit ko kasi bata na po, sir. Baka nasaktan. Sige. Okay, sir. Normal findings lang po, sir. Now, sir, I will palpate it again, but now, one na po, sir. I-flexion na po yung muscle na po, sir. Yun, parang ititigas niyo po, sir, muscle. Yan, mabigas na po. Palpate. Same lang po kanina. Yung areas na pinalpate ko po. Iga lang po. Iga lang, sir. Iga lang. Straight lang po. Iga lang. Okay, sir. Normal findings po, sir. No findings of muscle spasticity that affects movement of muscle, and there are no, and the muscle contraction are good. And based on my palpation, good blood flow po that cause the muscle to be in good condition, and so it can move appropriate. So now, sir, I will compare your muscle within left to the right side of your body. So, sir, findings, left and right muscle are in the same strength. I mean, symmetry po between the details for portion po siya. Left part of the body that have muscle, and right part of the body that have muscle. Symmetry po siya and proportion. So, sir, I will do the strength test po, sir. Kamusta lang? Strength test po tayo, sir. So, sir, try to press my arm using your left one po. Press niyo po. Good strength po. Next yun ito po, sir. Press niyo po. Okay po. So, sir, shrug your shoulder po. Yan. Then, try nyo po, i-move yung paa nyo po while nandito po yung kamay po. Okay, yun ito naman po, sir. Flex nyo po muna and try nyo po i-move while nandito po yung paa. Okay, sir, good strength. Next, sir, I will inspect po for normal structure or if there are deformities in your bones po, sir. Sa bones naman po, so start po tayo sa lower bones, sir. Inspect po, sir, and palpate ko na po siya. To know its texture. I mean, if there are bones that are deviated from normal, that shows signs of plyuma or injury. So, sir, normal findings po, sir, between the area of your bones, there are no bones that show signs of injury or plyuma. And now, sir, I will, and bones don't have edema or not tender po. Ngayon po, sir, joints na po i-inspect po, sir, if may swelling po. So, yung mga joints nyo po, Yung dito po, joints nyo sa taas. Sa pectoral muscle and shoulder. And joints po, sir. Huwag po na po makilitis. So, normal part findings po, sir. I will now palpate each joints for tenderness, smoothness, or movement. Palpate mo na, sir. Mga joints po. Left part, the right part. This assessment requires that you should palpate all the joints that have in the body. Make sure that you can palpate all the joints so you can note if there are joints that are deviated from normal that need surgery. So based on my palpation, there are no swelling and presence of nodules. And joints are in good contraction when the patient is establishing a movement. Now, sir, I can ask you to move your arms, sir. Move your arms po. Ganito, sir, yung parang ganyan. Move your arms, sir. Sige, sir, move. Ganyan po, tapos straight niyo po. Then, yung shoulder niyo po, shrug niyo po. Parang ginaganon niyo. Shrug niyo po. And, yung legs niyo po, i-flex niyo po, legs niyo. Yan. Sige, sir. Okay, sir, good findings po. And normal findings po, it is not deviated from normal. Asan ito ka ba? Sir, asan ka ba? Now, sir, I will ask you, sir, to move your joints and I will measure it, sir. Move your joints, sir. Ganyan po, sir. Flex na po yung joints niyo. Asan ka? Sina lang. And i-measure ko po, sir, yung length ng movement of joints na po. So, based on my measurement, it is not deviated from normal. Last, the record findings to the MAR. Sir, upo po kayo ulit kasi sa ears na po tayo ngayon. So, sir, now we are asked. Sinta lang. Sinta lang. Yung kamera. I will now, sir, inspect the color and auricles niyo po sa ear niyo po. Also its size and its symmetry, and I will inspect the position of your auricles. So, normal findings po, sir, of your auricles. Now, sir, I will find symmetric. I will check your auricles, sir, to know its symmetry and good contour, and if it is in the good position, sir, or usual position. So, normal findings, sir. Now, sir, I will palpate the auricles na po to check for texture, elasticity, and if there are tenderness. Palpate ko po auricles na po, sir. Mamubiso. May sigarilyo. So, normal findings po. Now, I will pull your auricles upward. Ina lang po, downward. I will also fold the pinna forward. So, since nagre-return po siya sa normal position, it means po na normal findings po. So, sintanay. Sinta naman, Sinta. May sigarilyo, sinta. Okay, sir. Next, I will push your tragus po. Then apply. Last ya. Mira to lang. Last ya. Mira. Sir, kasi ka ba, sir? Relax lang ka. Then I will apply then I will push your tragus and apply pressure on the mastoid process po. Good findings po, sir. No nodules or tenderness or edema po. Next, sir, let's proceed of assessing your external ear canal and the tympanic membrane po. Sir, side po kayo. Tingin po kayo sa camera. In expecting the ear canal and tympanic membrane, if we're using a otoscope, we should attach it with a cerebellum on the otoscope. I mean speculum on the otoscope. So sir, I will now check for your ear canal and tympanic membrane. I cannot attach speculum kasi improvised lang yung ginagamit ko. So sir, normal findings po sir, in your external ear canal, there are no signs of lesion, pus, discharge, or blood. So now sir, I will tip your head away from me sir, then straighten the ear canal. Miraki, sinta lang. Then I will straighten the ear canal. Hold appropriately the otoscope and assist the patient head appropriately. Then be careful attaching the tip of the otoscope into the ear canal. Then I will inspect the tympanic membrane for color and for the gloss. So sir, tympanic membrane and ear canal nyo po are normal po, no discharge or discoloration po. So sir, meron pa po tayo last test for eyes, for ears po sir. So now sir, I will proceed po with your gross hearing acuity test. Sir, repeat nyo po yung mga sinasabi ko po. Beautiful. Lovely. Sir, I had some question. What is your favorite color? So sir, since nasasabi nyo po na sa akin yung mga words na say ko po sa'yo, it means that you have a great hearing po sir. Even normal voice tones lang po yung ginagamit ko. It is normal po sir, you don't have problems in hearing. Next sir, document findings in the MAR. But please note, if the patient is difficult in hearing our normal voice, we should do further checkup and perform that test, which is watch stick test. In this watch stick test, we should have the client occlude this one ear. Takpan nyo po one ear nyo po side and place a ticking watch into the opposite ear. And ask the client if he can hear it. But the distance must be 4 to 2 inches. Di po masyadong malapit. Lalagay natin yung tick watch po. Next, sir, for the test, which is Weber test, I will hold a tuning fork and activate it by tapping the fork gently against the back of my hand and near the knuckles by stroking the fork within my thumb and inner finger. Place the fork above the client's head and ask if the clients can hear the noise. Next, for the ring test, ask the client to block his ear by moving a fingertip in and out the ear canal. No. And hold the activated tuning fork on the nistoid process 1 year until the client state that the vibration no longer can be heard. Immediately hold the vibrating fork prongs in front of the client's ear canal. If necessary, push aside the client's hair as whether the client now hears the sound. Next, document findings into the MAR. If having problems, immediately report the result to the doctor. Yun lang po, ma'am. Thank you, ma'am. I hope we see each other if wala na pong ma'am, COVID, like face-to-face next month. Sana po makita natin ang isa't isa soon po, ma'am. Thank you po talaga, ma'am, sa patient. Bye, ma'am. God bless. Keep safe always po.